spotlight on success, embedding and evidencing outstanding support.
We've increasingly been working with a whole range of providers across different geographic areas, primarily in the UK, but increasingly New Zealand, Australia, and in other areas where the whole need to be able to provide both statutory and provider-specific evidence of quality of service delivered, plus also evidence of meeting minimum standards from a compliance perspective, and primarily being driven through demands of funders on the one side and inspectorate and quality standards organizations on the other. Traditionally, most organizations that we've come across, having implemented Iplanit in this area over 70 times, most organizations are dealing with this particular challenge through a paper-based processes. So, capturing the information in terms of how well the delivery of care is being carried out at that point of care, that information is becoming an increasingly burdensome task. The plethora of reports from an administration point of view, the complexity of data that needs to be captured is growing as more and more regulation is introduced into the sector. And so we've put up here on this slide a couple of examples of the different areas or drivers that we've come across, whether it's in the UK, working within the adult social care market or indeed children's services, but initiatives such as valuing people, supporting people, the quality assurance framework, independent benchmarks such as the REACH standards, the talking point standards in Scotland. They've all been well established over the years in terms of providing benchmarks towards good practice, towards what works and what works well, and towards what to measure. From a KPI or an LPI, that's leading performance indicator perspective, many providers are well down the road in terms of paper-based and some automated approaches to tracking how well services are delivered against these various indices. We have the ASCOF framework, and then increasingly in other geographies such as in Ireland, the Republic of Ireland, we have the new direction standards coming out of the National Health Service. We've always had personal outcome measures that have come originally out of the US that are in use particularly a lot in Australia and New Zealand, but they're also used across the UK. Our partner National Disability Services have their own outcome framework that they'll roll out across their memberships, and other standards such as the Keep to Life, similar to REACH. And the outcome framework data set becomes yet another industry-specific approach to benchmarking and monitoring quality of care delivery, but coming less from a statutory perspective and more from a good practice perspective. So this is just a sample of, I would say we've come across 20 to 30 different statutory / good practice indices, benchmarks over the years, and all of those we have automated and encoded within Iplanit. But as you can see, for an organization who might have operations in Scotland and in England, who has to be able to track across multiple different statutory and provider-specific frameworks, it becomes a lot of administration tasks, a lot of administration overhead, and the opportunity or risk rather of information being inaccurate, duplicated, out of date, and raising the whole spectre of potential issues in the area of compliance and safeguarding and so on is something that increases as these benchmarks become more and more common. So the traditional approach has, in terms of technologies within the sector from a provider point of view, has been focused on a checklist-based approach to monitoring and following and tracking quality. So it's been pretty much paper-based, you know, and focused on inputs and focused on time and task, making sure that there is an audit trail and making sure that the provider has done and has been seen to have done the right things. But we are seeing the sector move from that input-oriented focus to a more relationship-based service delivery model, whereby you know, we have a lot of new and emerging concepts such as co-production and personalization, people having inclusion and ownership of their plans, but also the outcomes. And whilst most individuals in receipt of services may not have a primary concern around how that impacts national standards and national quality standards and so forth, there is that level of transparency and visibility that is now introduced into the equation that hasn't been there before. So we see a focus less on inputs and more on what is the impact of these services as they are being delivered. In terms of an Iplanit response to and how Iplanit is used in this context, we see that what we've got here is essentially the paper trail associated with reporting broken out into 4 arrows. On the top left-hand side, we have the compliance-related statutory key performance, lead performance indicators, which we've just covered. And then we have typically across providers, a lot of provider-specific KPI. Depending on large national providers, will have multiple variants of these, and many of them would be introducing standards around this. And then on the right-hand side, we have various initiatives around outcome frameworks and planning approaches, which are geared towards evidencing value and driving up quality and quality standards across service provision. And then we have various provider-specific outcome frameworks and planning approaches as well. The focus of today's examples will really just be on the top left-hand side, which is on the statutory key performance and lead performance indicators. And how does it do this? It does this by gathering the data specifically in the context of the statutory key performance indicators. This top left-hand corner, the blue arrow. It gathers data around risk, around assessments, around incidents, around, you know, the distance travel, the progress for that individual in relation to their plan, in relation to their outcomes, in relation to supporting actions. So how is that, you know, all that information combined with the person profile data is gathered into Iplanit in a way that is configured around the provider's specifics reporting requirements. That information is gathered into reports. That's provided to the provider managers in the middle here, and then on the left-hand side it's provided to the inspectors, and in turn provider management can use that information to help inform dialogue with funders around typically the evidencing of value. Those reports are typically done in a way that crucially is transparent if needed with the clients, and even if the client doesn't see the reports, at least they have the opportunity, if the provider so wishes, to be able to see how things are going in terms of the delivery of services relative to their plan, their outcomes, and so on and so forth. And that level of transparency can in turn provide an authentic stamp to the dialogue with the inspector, with the funder, in terms of the value of those reports that are configured and driven out of the Iplanit system in a way that is specific to that particular provider's needs.
So today I'm going to mainly look at evidence in some of the UK and Ireland statutory KPIs. And for example, you have the Regulation and Quality Improvement Authority for the Northern Ireland, and then you have your Health Information and Quality Authority for the Republic of Ireland. You have your CQC, your 5 key lines of inquiry for England, which I'm sure you guys are all familiar with. And then you also have your social care and social work improvements for Scotland, and then not forgetting the CSSIW for Wales. So they have very similar themes, and they're usually set out between 5 and 8 standards or themes. And then there's also, not forgetting our international customers, there's also the New Zealand Ministry of Health KPIs, and again the Australian Government Department of Social Services. So again, you can see that the themes are very, very similar with slightly different wording. And what we'd like to do today is just to show you how Iplanit supports compliance and evidencing across all of our international and UK and Ireland customers. So some of the things that we do within Iplanit, how you work within Iplanit, how you create that culture within your organisation, and then also how you actually evidence the physical evidence to the inspectors. And we do this in a variety of ways, which I'm going to demonstrate shortly. So we put the spotlight on quality, evidencing your high quality services, and we do that in many ways. And in Iplanit, some of you who have come across Iplanit will have seen the dashboard and some of our risk management modules and the notifications, which I'm going to refer to on my last demonstration section. Measuring the value and evidencing the value to all of your stakeholders. So this is not just about your statutory KPIs. Iplanit covers an array of reports, an array of evidence, but today I'm going to mainly link it to the Commissioner KPIs. And then you have your reducing risk, monitoring, care and support delivery, and we can do that through our risk management process integrated into the support plans. We also have the separate module of the needs and risk assessments, and then we also have our incident tracking, our incident management module, which all forms part of that reducing risk. So not only are you practicing in a really clear reducing risk way, you can also evidence it. And then you have the being efficient, optimizing resources and reducing the paperwork overhead. That's always a benefit, always a plus. Through our support tasks, our staff tracker module, through our reporting, and through our funding module, budgets, and of course our web-based support plans. And then let's not forget the being inclusive. So whether that's a priority business need right now, the point is that Iplanit offers this as almost a side effect. This happens anyway. So you can make sure that you're including all the stakeholders, improving the client stickability. So at the Iplanit client portal and for their families and friends and their circle of support, which is going to be the first thing that I show you. So I'm not going to go through all of these slides today, but it's just to give you an example of some of the things I'm going to demonstrate. So you could have a look at, for example, the Scottish standards around dignity. Enjoy a full range of social relationships. So how do you evidence that right now? Well, in Iplanit we have many ways that we can evidence it, where you can walk through the Iplanit system with the inspectors, as one of our existing customers has just recently done and had some excellent feedback from the CQC, this was in England, about how easy it was to navigate around and how the evidence from the plans alone was excellent. And you can also look at the calendar for the person and the outcomes for the person. So if you want to evidence that full range of social relationships, that becomes more and more possible on Iplanit, as well as all the other methods that inspectors use about talking to people, talking to staff members, doing the visits. Then we want to make sure that we complement everything that the inspectors have to do.